All right, today we're going to show you how to don and doff the posterior foot splint, which is also known as a TAFO and or a Seattle splint. This is a splint that is used by OT for preventing muscle tightness, protecting soft tissues such as flaps, and protecting healing fractures. There are two versions of the splint. This is the standard version. There's another version that's for X fixes that just has a little bit more of a cutout here to accommodate the extra hardware. Splint wear time varies based on the purpose for its use. So please refer to the OT splint sheet in the patient's room, the OT nursing splint orders, or the splint flow sheet in Epic to see the recommendations for wear schedule and any other additional positioning or lining recommendations that we might offer. The splint should be removed one time per shift to assess skin and splint position. If dressings are present, check skin integrity when the dressings are changed, but still remove the splint one time per shift to assess the fit and ensure that it's fitting correctly. Areas to assess include the heel, bilaterally, both sides, the back of the heel, the ankle, both sides of the ankle, the pad of the foot, and then the lateral aspects of the foot, and then also the back of the calf as well. And then anywhere that the straps might potentially rub, so over the ankle and kind of up higher on the leg. And you're going to be looking for redness, skin breakdown, bruising, and then also assessing with the patient if they can answer questions about pain or discomfort. To don the splint, you're going to place the foot flat against the foot plate of the splint, and then if you can, based on their injury, you'll provide gentle pressure at the front of their ankle to kind of fit the foot down into the splint. The heel of the foot should be floating over the heel of the splint. The splint itself is blown out a little bit at the bottom to accommodate the heel and allow for space so that the heel isn't in contact. Okay. If for some reason you're putting the splint on and you cannot get the patient's foot in this position, whether that's due to tightness, dressings, an injury, or any activity restrictions, please talk to the OT who can do a little problem solving or determine if this is even the most appropriate splint. So after we have the foot in the splint, we're going to take the padded ankle strap first. That's going to go over the patient's ankle. There's a little clip on the other side that will place it in, and then we gently pull on that strap to tighten. You want to make sure you can fit a finger underneath the strap so that it's not too tight. Then we will place the second crisscross strap here over the padded one. Again, just hooking the bar into the little clasp, pulling to tighten, and then last we place the top strap. And you can adjust the pads too so that they're kind of resting on those bony areas of the foot and the leg. Okay. And then ideally with these splints, you want the leg to kind of be positioned so that the toes are pointing upwards, knee is pointing upwards. They don't fit well if the leg is rotated. So sometimes we will use pillows, wedges, or trochanter rolls to position them. If that's the case, the OT will try to give you those instructions ahead of time. To remove the splint, we just release the strap. So you can start with the top one here, that ankle, and then the second ankle. And then you can gently lift the patient's leg out of the splint. So situations when to contact an OT to discuss any changes with the skin that you might notice in regards to the splint. If they have significantly increased or decreased edema that could affect the fit of the splint. Any changes in the range of motion or positioning activity orders by the doctor or the surgeon. If the patient is reporting pain or if you're noting signs of pain or discomfort. And if the patient is extremely agitated, those might be times to collaborate with the OT because they can kick these splints off or they can reposition themselves in the splint and cause pressure injuries. If you do feel that the splint isn't fitting because their ankle is tight, again, please contact the OT so they can kind of decide if this is the correct splint for the patient. And then the last thing to note about these splints is that they are very slick on the bottom. They are not safe for weight bearing. So they should not be worn with patient that is standing or walking around, therefore in bed only.